And speaking of digital health leaders, we have Jessica Saperstein from Novartis, who heads up patient centricity and is someone with a deep experience in user experience, user design. And Jessica, thank you for joining us today.
Thank you for having me. It's been fascinating just listening to the diversity of perspectives. And I think they all kind of come back to that anchoring around the customer and what's happening and how digital is enabling it. So happy to be here.
Incredible, right? I'm just really happy to have you here. And again, you're a faculty at Columbia Business School with a digital health program as well, and have provided so many deep insights to so many of the executives in that program and students in that program. But really wanted to bring some of that expertise into the public. And again, this is a free program, obviously, folks from around the world attending. But really wanted to start off, and we've only got 10 minutes, unfortunately, but wanted to start off with just a 30-second sketch of your background. Everyone's going to link in with you, I'm sure, before this is over, but give us a little bit of your background.
Sure. So my background is really cross industry, and I would say that has been really my focus in my career has been on customer driven growth across industries. Started my career as a consultant, but then worked in OTC healthcare, then worked in HR technology, then worked in the car rental industry, and did another stint in consulting, and now back in healthcare and pharma. And I would say the most fascinating thing is how much commonality there is, and actually bridging some of the lessons and insights, especially in this area of digital customer experience, where pharma now is so focused on bringing in that consumer grade experience to HCPs, to patients. So it's a really exciting time to be working in pharma and working in healthcare, given everything that's been happening.
It really is. And so dive into that. Let's kind of double click on that point a little bit. Why is customer experience and that patient centricity so critical right now for pharmaceutical manufacturers?
Yeah, it is because customers, patients, and physicians are much more empowered now. And we've been talking about this for many years, but I think with the growth of the growth and penetration of digital tools now has been significant. And the pandemic really accelerated it. I mean, these teams like mine at Novartis were underway and in the planning stages before the pandemic, but we got a lot of acceleration because people were stuck in their homes. People couldn't get healthcare in the way they would normally. They also had a lot more time to be doing research and leveraging digital tools. So the incredible increase in penetration on patient portals and digital tools and telemedicine, which I know has been a topic for today, is phenomenal. I don't think would have happened at the same level, but I think those trends are there. So why is customer experience important? It is because the customer is a driver. And I mean, even with things like access to medications, access to healthcare, it is so much more customer driven now. And so manufacturers and pharma players and healthcare providers have to be attuned with that, or they're going to lose out on access to the patient. And so it is really business critical now.
It is. So, and thank you for bringing that up, because I think one of the things is that, like you mentioned, there's so many things at Novartis have been underway for even more than just kind of just before the pandemic. But things like the Novartis Biome, one of the leading digital health ecosystems out there, and then obviously all the good work that Robin Roberts and Jake Laporte did with that, and then having a CEO like Vas, who is he comes at it from a scientist perspective. He comes out of the R&D side of Novartis, but as the CEO, he said right away, data science is our future. So that kind of perspective and that kind of leadership has been over the last few years now, since he was really, as he emerged as the CEO there, has been critical. But what therapeutic areas have you seen now across the enterprise, R&D, the biome, and patient centricity are you guys focusing on within a digital health ecosystem?
Yeah, I mean, it's relevant across all of our therapeutic areas, I would say. I mean, I personally have been doing a deep dive in some of the, psoriatic disease, psoriasis, and rheumatoid arthritis, but they're, across all of our indications, I think we are seeing the same consumer needs or jobs to be done are there. So in fact, what we are doing is also, and I know a lot of my colleagues in other companies are doing this as well, kind of stepping back and really saying, what kind of tools, infrastructure, and support do we need digitally to support patients and to support HCPs, given the way they're expecting to interact with us and given the problems they're trying to solve in their healthcare. And so I think common themes around, they're looking for personalization. And so digital enables us to personalize message and interaction in a much stronger way. They are looking for engagement, and they're looking for less friction in the solutions. And, it actually does not matter what therapeutic area we're talking about. Those are common needs, and those are common themes that keep coming up.
That really is, right? And I think that's such an important part of understanding the ecosystem. And again, over the last decade, there's been a growing trend toward direct-to-consumer marketing within life sciences. And do you think that trend is going to continue and expand with the post-pandemic recovery that we're seeing around the country, certainly in the Northeast, or do you think that's going to trend back more toward traditional media?
I do think that's going to expand. Those certainly are the trends that we've seen. And, it's here in the US. I mean, DTC media is a huge investment and it's a huge focus. And the competition in the market, just precipitates that, because if you're in a highly competitive sector and you need to get your message out there, you're going to have to, all of the manufacturers have, I think, really upped their investments there. But I think the trend we're also going to see is continued focus on consumer, but much more targeted where we can. The days of mass market linear TV, I think, are, going by the wayside. And there's much more of a focus of finding targeted ways, whether it's addressable or connected TV or other digital ways, to access the target patients and those who are most in need and most relevant to the messaging we need to put out there.
Yeah, it really is. And we've got about 2 minutes left, but I've got several more questions for you, and we've got questions coming in from the audience, but would love to know, in terms of just the future of this and your forecast for digital health and patient centricity over the next few years, what are you seeing as some of the bigger trends emerging from everything that's happening in your field?
Yeah, I mean, I think it's continuation of what we've seen, right? It's looking for ease of access, self-service, which are things that have been common, again, across lots of other consumer industries and now coming into healthcare. Reduced friction, the ability to access what they need, and transparency. And I think those, especially in healthcare where you've got complex medications that might take weeks and weeks to get access to and get through the system, customers, physicians, and consumers don't have the patience or the desire to do that anymore. So I think those experiences with Amazon getting into healthcare in a much bigger way, we're going to see change, whether companies like it or not, and whether they're ready or not. So I think it's going to behoove all of us in the industry to be ready and to continue to push there.
No, well, that's great. Jessica, thank you again. And thank you for your help with the program at Columbia, the digital health program at Columbia Business School. Your lectures there, your involvement there, also phenomenal, and hoping to see you again on another HitLab program soon. Thank you.
Terrific. Thank you.